Hi, I would like for you to sit back and think, do you know any friends or family members that have been born with a genetic disorder? Most of you are probably shaking your heads no, because most genetic disorders are rare. Some are common, but most are rare. For instance, Joubert syndrome, which is caused by mutations of several genes and lead to symptoms and treatment and prevention to try to help with the disease. This disease is so rare that it only affects 1 in 80,000 infants each year. So you're probably wondering, what is Joubert's disease? Joubert's disease is the underdevelopment of your cerebral vermis and your spinal cord in infants that affect their overall body. These infants get this disease through two different inheritance patterns. The first and most common is autosomal recessive, which can be passed down from parents to an infant. And the other type is X-linked recessive, which is most common in infants that are males because they have an X and a Y chromosome versus females that have two X chromosomes. So it's more common and easier for the males to be affected by this disease. There are over 30 genes that are mutated to get this disease, but there are 5 most common, which include NPHP1, AH2, CEP290, TEMM216, and OFD1. These mutations cause conditions such as kidney diseases, retinal dystrophy, and vision impairment. So you're probably wondering, what does a child with Joubert's syndrome look like? There are several symptoms, but the main one is facial features. So if we look at children with Joubert syndrome, we can see that a lot of them have broad foreheads. They also have low set ears, and normally they're a little bigger and floppier. They have droopy eyebrows and eyes, and they'll have a triangular shaped mouth. You can also look at the overall formation of the infants. So they commonly have this syndrome called floppy child syndrome, which is just the underdevelopment of their bones and their muscles, which cause them to not be able to hold themselves up and walk and move without assistance. These children also have other symptoms such as kidney disorders, which was mentioned previously, and eye movement. So they're unable to focus and look at certain things at certain times. So these symptoms are common with other diseases also. So another good diagnosis that we use to see if an infant has Joubert disease is MRI imaging. When looking at MRIs of children and trying to diagnose Joubert's disease, the main thing we look for is what is called the molar tooth image, which is just an elongated cerebral peduncle in the brain. So if you see, this are images of a normal brain versus an infant that has Joubert syndrome. And if you look at the superior cut, you could see the molar tooth sign, which indicates that the child, in fact, has Joubert syndrome. Although there's not much that we can do for prevention of this disease, we can do a little bit. So if parents are pregnant again and have previously had a child with Joubert syndrome, we can do prenatal testing to see if this child has the same mutations in the same genes as the previous one, to see if there's a possibility that they will have Joubert's disease also. But unfortunately, the disease is pretty bad and effective. There are treatments to help with the disease, such as supportive and physical. So there's physical therapy, occupational therapy, and speech therapy to help with their motor muscle movements and with their speech. Although this disease is unfortunate, the month of October is dedicated to not only breast cancer but also for infants and individuals with Joubert syndrome. Therefore, if you have any friends or family members that do have genetic diseases, it is often good for you to go out and learn about the diseases and learn how you can help those that you love and know with the disease. Thank you.